Apps masterclass, we'll be learning about the anatomy of the external ear. So, whenever we talk about anatomy of external ear, first thing we remember is the pinna, and we all know this is how it appears. Okay, so pinna is a folded piece of cartilage. You can see here all of this is the pinna, and it is a folded piece of cartilage. The next is the structures of the pinna are the helix, that is over here, the antihelix, the tragus, we all know what the tragus is, the antitragus lies over here, and the concha, then the Cymba concha. Okay, this is the concha. Then Cymba concha is a cartilaginous landmark for the antrum, and MacEwen's triangle is the bony landmark for the antrum. This is important for the antral approach for a few ENT surgeries. So the Cymba concha is a cartilaginous landmark for the antrum, and MacEwen's triangle is a bony landmark for the antrum. Now let's look at the boundaries of mastoid antrum. As you can see, superiorly it is formed by the dural plate. Okay, it separates the antrum from the temporal bone. An important exam point over here, the temporal lobe abscess is the most common infection after middle ear infection. Okay, so temporal lobe abscess, please remember, is one of the most common ear infections. Next, posteriorly, it is formed by the sinus plate. Okay, so this is the sinus plate, and it is forming the posterior boundary of the mastoid antrum, and inferiorly, as you can see, it is formed by the stylomastoid foramen along with the facial nerve. So, the boundaries of mastoid antrum include superiorly the dural plate, posteriorly the sinus plate, and inferiorly the stylomastoid foramen along with the facial nerve. Now, what is Citelli's triangle? It is also known as Sino Dural angle. You can see here the Sino Dural angle. It is the angle between the sinus plate and the dural plate. Okay, that is easily seen from the diagram. It is the angle between the sinus plate and the dural plate. This is known as Sino Dural angle. Then MacEwen's triangle, we have just seen that it is an important bony landmark for the antrum. So mastoid is drilled only in this particular area. That is why MacEwen's triangle is so important. Okay, then the skin on the medial side is loose skin, and that on the lateral side is tight skin on the mastoid antrum. Now that we have spoken about the approach to the middle ear, let's see how this is done. For approaching towards the middle ear, the external auditory canal is never used because the cartilage tends to collapse, and also there is a risk for perichondritis. That is why an endoral approach is used. That is, an incision is made on the incisura terminalis, okay, that is between the tragus and helix. So directly it is not approached from the external auditory canal because the cartilage will collapse and there is a risk of perichondritis. So an approach going between the tragus and the helix called as the endoral approach is used. Now let's look at the next structure, that is the Darwin's tubercle. It is a prominence at the junction of upper 1/3 and lower 2/3 on the posterior superior margin of the pinna. Okay. Now it is an atavistic feature, that is, it is a feature that is similar to the primates, and it is also present in primates as well. Now let's look at the image of Darwin's tubercle. So you can see here the Darwin's tubercle, this one over here. This is the prominence that is present at the junction of upper 1/3 and lower 2/3. Now let's proceed to the external auditory canal. Okay, so this is how the external auditory canal appears. The lateral 1/3 is cartilaginous and the medial 2/3 is bony. Okay, here is present the foramen of Huschke, and here is the fissure of Santorini. Now let's understand in detail. The external auditory canal total measurement is 24 millimeters. Please remember this length, and it is divided into cartilaginous and bony parts. We have just seen that. So the cartilaginous part constitutes the lateral 1/3 and measures about 8 millimeters, whereas the bony part, we know that it makes up the medial 2/3 and forms about 16 millimeters of the external auditory canal. And the narrowest part of this structure is the isthmus, that is present 6 millimeters lateral to the tympanic membrane. Okay, now when we talk about the direction, the cartilaginous part is directed upwards and backwards, whereas the bony part is downward and forward. It is up and back, it is down and forward. Now the lining epithelium for this part is same as the skin, so it will have hair and ceruminous glands as well. Okay. Then the lining epithelium for the bony part is stratified squamous epithelium and there are no skin appendages present. Okay. Now furuncle of the ear, we all are familiar with this. It is localized only to the cartilagenous part of the ear. And when we talk about the isthmus, whenever there is a foreign body in the ear, usually it is present in the isthmus, and removal of this is not easy. It requires surgical instruments. Okay. Now, two important points we are looking at are fissure of Santorini and foramen of Husky. Fissure of Santorini connects the cartilaginous part to the parotid and the base of the skull, and bony part is connected via the foramen of Husky. Please remember these two important questions. This foramen of Husky usually closes by 5 to 6 years of age. Okay. So fissure of Santorini and foramen of Husky. They connect to the parotid and the base of the skull. Now let's look at tympanic membrane. As you can see, this is how it appears. It is known as the window of the middle ear. Okay, it is derived from all the three germ layers and the normal color is pearly grey or pearly white. Okay, and it makes an angle of 55 degrees with the horizontal. Okay, so these are the parts. This is pars flaccida. This is the cone of light, our famous cone of light. This is the shadow of incus that you're seeing here, and this is the lateral process of malleus. This part is known as pars tensa, all of this part. Okay, and here is the shadow of round window. Please make a note, it makes an angle of 55 degrees with the horizontal. Now what are the borders? The anterior border is tilted towards the middle ear, that is, it is present more medially, whereas the posterior border is more accessible. Why so? Because it is tilted towards the external auditory canal. So the posterior border is more accessible, not the anterior border. Okay. Now we have just seen there are two divisions, that is the pars flaccida and the pars tensa. Pars flaccida is forming the upper 1/3 and pars tensa is forming the lower 2/3. So the most common site for formation of a retraction pocket is pars flaccida. Okay, and the center of pars tensa is dented by tip of the handle of malleus, where it attaches and forms the famous umbo. Okay, the cone of light emerges from the umbo over here. As you can see, it is due to the obliquity of the tympanic membrane and the reflection of the handle. So the cone of light emerges from the umbo due to obliquity of tympanic membrane and reflection of the handle of the malleus. Okay, the most mobile part of these two is the paramedian part. Now another important point for identification, the cone of light is always present in the antero-inferior quadrant of the ear. Let's apply this. So if you see here, we are trying to identify the side of the ear from looking at the tympanic membrane. Two things we need to observe are the cone of light and the upper tilt of the tympanic membrane. So if it is the right ear, the upper tilt is towards the right and cone of light is also towards the right, as you can see here. And in the left ear, obviously the upper tilt will be towards the left and the cone of light will also be towards the left. Okay, and suppose there is no tympanic membrane, there is a perforated membrane, we will have to observe only the upper tilt, and if it is a right ear, it will be tilted towards the right side. Okay, so a few more points about tympanic membrane. The total surface area of tympanic membrane is 90 mm square. However, the effective vibrating surface area is only 55 mm square. So the surface area in toto is 90, effective vibrating